We have breaking news coming out of China. Bird flu cases are at record highs across China, with reports of person-to-person transmission across China. Scientists are warning that this particular strain could have pandemic potential over the course of months, with potential lockdowns being put into place. Currently, China is being locked down as an attempt to contain the bird flu virus known as H5N1. Officials in China are urging people not to travel for non-essential reasons, and that a mask rated N95 or higher must be worn at all times when in public. A travel ban has been put into place for all flights entering and exiting the airports within the country of China, with flights that are bound for China being diverted to airports in surrounding areas. The Centers of Disease Control and Prevention is currently monitoring for cases that may be in the U.S. among travelers from China. Symptoms of this virus include pink eye, fever, fatigue, cough, muscle aches, sore throat, nausea and vomiting, diarrhea, stuffy or runny nose, and shortness of breath. Possible complications include pneumonia, acute respiratory distress, bacterial infections, sepsis, brain swelling, and respiratory failure. It is known that the virus has acquired mutations that make it resistant to antiviral treatment, with no vaccine currently available for this particular flu strain, with a mortality rate as high as 50%. Immediate medical care is needed for symptoms such as fever above 104 degrees Fahrenheit or 40 degrees Celsius, difficulty breathing, confusion or altered mental state, severe fatigue with an inability to remain awake, severe headache, and stiff neck. Officials in China recommend quarantine for at least 10 days after exposure to the virus, with the CDC recommending the same for U.S. travelers returning from China. We will continue to provide updates as the situation continues to develop over the course of weeks to months.
Breaking news. Lockdowns have been ordered by the Parliament, which take effect immediately. Due to the high number of bird flu cases, the Parliament has ordered the immediate closure of all non-essential businesses, with residents being ordered to shelter in place immediately.
We interrupt this broadcast with emergency information from the UK Parliament. Listen very carefully to the instructions this broadcast will now give you. All channels will play this emergency message. All phone and tablet devices will be sent additional information following this message. Her Majesty's Government, the Parliament, and Public Health England have ordered all residents of the UK to remain in their homes. No one is allowed to leave their homes under any circumstances. Effective immediately, the British Army will be brought in to enforce the rules and provide tat-irons for those without provisions. Martial law will take effect immediately. Normal law is suspended and military orders are final. Disobeying orders will result in immediate execution. Looters and petty criminals will be shot on sight. If you leave your residence, you will be given one warning. If you fail to obey, you will face immediate execution. Schools are closed until further notice. Exams have been postponed and their rearrangement will occur when the crisis is over. You are advised to ration your provisions and eat non-perishable items first. Pink eye and dry cough are the two main symptoms of H5N1 known as the bird flu. BBC studios will close shortly, but radio broadcasts will continue on all BBC radio channels. All bills and payments have been suspended. Be aware other people may be brought into your homes should something happen to theirs, such as a house fire. If family members are abroad, you should inform them of your situation. They will not be in the same situation and will have to follow the advice of the nation they are in. All British overseas territories will follow these measures where possible. If provisions become an issue, the military may order food to be taken outside for rationing. If pets become an issue, you are given the ability to euthanize them as humanely as possible. Should you do this, take the corpse outside and place it gently on the floor. All non-essential travel is prohibited and any attempts to cross roadblocks will be met with lethal force. If relatives are missing from your home, contact them now and instruct them to return immediately. From now onwards, any persons found outside will be taken to the nearest home and you will not see them until the crisis is over. All essential services will remain online unless the situation becomes worse. We will inform you when this happens. You are reminded of your rights. Military officers may not enter your home unless they have evidence of criminal intent. Any attempt to do this by a soldier should be met with lethal force by other soldiers. They are there to protect the public and enforce the rules, not to sterilize the population. There is no definite end date as to when this will end, although mid-June is the best estimate. However, this may shorten or lengthen, and we will inform you when a definite date has been set. Follow basic hygiene rules. Wash your hands, sneeze into your elbow, and catch it, bin it, kill it. This is our final broadcast until further notice. Stay safe and good luck.
Good morning. We have breaking news on the bird flu outbreak across the United States. Over 10,000 cases of the bird flu have been reported across the United States, with about 3,500 cases in Michigan. A shelter-in-place order is being considered for the state of Michigan in the event that the situation continues to get worse. The CDC recommends following quarantine guidelines given for the bird flu for about 10 days. A PCR test is currently being used to test patients for the virus. If you test positive, you are to quarantine immediately. Hang on. We have a message from the emergency alert system for the state of Michigan. Please stand by while this message is transmitted.
The following message is transmitted at the request of the Michigan Executive Office of Governor. The State of Michigan Stay Home, Stay Safe order takes effect at midnight tonight. Non-essential travel is prohibited. As necessary, you may leave your home for health and safety reasons, to get groceries and supplies, for certain outdoor activities, and to care for others. Businesses must limit in-person operations to those necessary to sustain or protect life. All individuals who leave their home or residence must adhere to social distancing measures recommended by the CDC. For additional guidance, see https://www.michigan.gov. Regard animals diseases avian influenza.
H5N1 is deadly. Stop the spread now. Stay home. Only leave for essential groceries, prescriptions, or medical appointments. Ignoring public health directions endangers lives. Stay home. Protect yourself and others. www.alberta.ca/avian-influenza.
Le virus H5N1 est mortel. Stoppez sa propagation dès maintenant. Restez chez vous. Ne sortez que pour des achats essentiels, des médicaments ou des rendez-vous médicaux. Ignorez les consignes de santé publique met des vies en danger. Restez chez vous, protégez-vous et protégez les autres. www.alberta.ca/avian-influenza.
Buenas tardes. Tenemos una nueva actualización sobre el actual brote de gripe aviar, que está provocando un número muy elevado de casos en todo México, con una tasa de mortalidad de aproximadamente el 50%.
El siguiente mensaje se transmite a petición de la Secretaría de Salud. Se ha reportado la presencia de un virus denominado H5N1 en todo México. Se han registrado hasta 100.000 casos y 50.000 fallecimientos en el país. Se ordena a los residentes permanecer en sus hogares y no salir, salvo por motivos esenciales indicados por las autoridades.
The following message is transmitted at the request of the Secretariat of Health. A virus called H5N1 was reported across Mexico. There have been reports of up to 100,000 cases with 50,000 deaths in the country of Mexico. Residents are ordered to remain at home and do not leave unless it is for essential reasons as given by authorities.
Stand by. The President or his designated representative will be speaking over the emergency alert system shortly.
In December 2026, a novel new influenza, the virus was first detected in Wuhan, Hubei Province, People's Republic of China, causing outbreaks of bird flu that has now spread globally. The Secretary of Health and Human Services, HS, declared a public health emergency on the 1st of March 2027 under Section 319 of the Public Health Service Act, 42 U.S.C. 247D, in response to bird flu. I have taken sweeping action to control the spread of the virus in the United States, including by suspending entry of foreign nationals seeking entry who had been physically present within the prior 14 days in certain jurisdictions where bird flu outbreaks have occurred, including the People's Republic of China, the Islamic Republic of Iran, and the Schengen area of Europe. The federal government, along with state and local governments, has taken preventive and proactive measures to slow the spread of the virus and treat those affected, including by instituting federal quarantines for individuals evacuated from foreign nations, issuing a declaration pursuant to Section 319 F.A.3 of the Public Health Service Act, 42 U.S.C. 247D, F6D, and releasing policies to accelerate the acquisition of personal protective equipment and streamline bringing new diagnostic capabilities to laboratories. On the 13th of March 2027, the World Health Organization announced that the bird flu outbreak can be characterized as a pandemic as the rates of infection continue to rise in many locations around the world and across the United States. The spread of bird flu within our nation's communities threatens to strain our nation's healthcare systems. As of the 15th of March 2027, 43,645 people from 47 states have been infected with the virus that causes bird flu. It is incumbent on hospitals and medical facilities throughout the country to assess their preparedness posture and be prepared to surge capacity and capability. Additional measures, however, are needed to successfully contain and combat the virus in the United States. Now, therefore, I, Donald J. Trump, President of the United States, by the authority vested in me by the Constitution and the laws of the United States of America, including Sections 201 and 301 of the National Emergencies Act 50 U.S.C. 1601, etc., and consistent with Section 1135 of the Social Security Acts, S.A. as amended, 42 U.S.C. 1320b-5, do hereby find and proclaim that the bird flu outbreak in the United States constitutes a national emergency beginning the 15th of March 2027. Pursuant to this declaration, I direct as follows. Section 1. Emergency Authority. The Secretary of HHS may exercise the authority under Section 1135 of the SSA to temporarily waive or modify certain requirements of the Medicare, Medicaid, and state children's health insurance programs and of the Health Insurance Portability and Accountability Act privacy rule throughout the duration of the public health emergency declared in response to the bird flu outbreak. SEC 2. Certification and notice. In exercising this authority, the Secretary of HHS shall provide certification and advance written notice to the Congress as required by Section 1135 of the SSA 42 U.S.C. 1320b-5 SEC 3 General Provisions. And nothing in this proclamation shall be construed to impair or otherwise affect I, the authority granted by law to an executive department or agency, or the head thereof, or either functions of the Director of the Office of Management and Budget relating to budgetary, administrative, or legislative proposals. B, this proclamation shall be implemented consistent with applicable law and subject to the availability of appropriations. See, this proclamation is not intended to and does not create any right or benefit, substantive or procedural, enforceable at law or in equity by any party against the United States, its departments, agencies, or entities, its officers, employees, or agents, or any other person, in witness whereof I have hereunto set my hand this 15th day of March, in the year of our Lord 2027, and of the independence of the United States of America, the 251st.
This concludes this broadcast of the emergency alert system.
Breaking news, the first ever mRNA vaccine for bird flu was approved by the Medicines and Healthcare Products Regulatory Agency, which shows about a 95% effectiveness in reducing the severity and transmission rate of bird flu. The rollout will occur in phases, which begins in the elderly, who will receive the vaccine starting next month, with people aged 50 and older receiving it in January of 2028. Then, as the rollout continues, people aged 18 and older will then receive the vaccine beginning in February of 2028. Children 12 and older will begin receiving the vaccine in March, with younger children receiving it in April. This is done in phases to allow the Medicines and Healthcare Products Regulatory Agency to study the vaccine in each age group before approving it, much like how the COVID-19 vaccine rollout began. The Parliament states that all residents should get vaccinated as soon as possible when they become eligible to receive it, as it will help reduce the severity of the disease and help build what's called herd immunity, where the community has collective immunity that helps protect themselves and vulnerable parts of the population. It is still unknown if natural infection provides immunity, which is why Public Health England urges people to get vaccinated even if they have been sick with the virus, with the timing occurring after the isolation period of 10 days. More updates on the vaccination progress will be made once the rollout begins in the UK.
Breaking news. The first ever mRNA vaccine for bird flu was approved by the Public Health Agency of Canada, which shows about a 95% effectiveness in reducing the severity and transmission rate of bird flu. The rollout will occur in phases, which begins in the elderly, who will receive the vaccine starting next month, with people aged 50 and older receiving it in January of 2028. Then, as the rollout continues, people aged 18 and older will then receive the vaccine beginning in February of 2028. Children 12 and older will begin receiving the vaccine in March, with younger children receiving it in April. This is done in phases to allow the Public Health Agency of Canada to study the vaccine in each age group before approving it, much like how the COVID-19 vaccine rollout began. The Public Health Agency of Canada states that all residents should get vaccinated as soon as possible when they become eligible to receive it, as it will help reduce the severity of the disease and help build what's called herd immunity, where the community has collective immunity that helps protect themselves and vulnerable parts of the population. It is still unknown if natural infection provides immunity, which is why Public Health Agency of Canada urges people to get vaccinated, even if they have been sick with the virus, with the timing occurring after the isolation period of 10 days. More updates on the vaccination progress will be made once the rollout begins in Mexico.
Noticia de última hora. La Comisión Federal para la Protección contra los Riesgos Sanitarios ha aprobado la primera vacuna de ARNM contra la gripe aviar, que muestra una eficacia de alrededor del 95% a la hora de reducir la gravedad y la tasa de transmisión de la enfermedad. La campaña de vacunación se llevará a cabo por fases, comenzando por las personas mayores, que recibirán la vacuna a partir del próximo mes, mientras que las personas de 50 años o más la recibirán en enero de 2028. A medida que avance la campaña, las personas de 18 años o más recibirán la vacuna a partir de febrero de 2028. Los niños de 12 años o más comenzarán a recibirla en marzo y los más pequeños en abril. Este enfoque por fases permite a la Comisión Federal para la Protección contra los Riesgos Sanitarios estudiar la vacuna en cada grupo de edad antes de aprobarla, de forma muy similar a cómo se inició la campaña de vacunación contra la COVID-19. La Comisión Federal de Protección contra Riesgos Sanitarios afirma que todos los residentes deben vacunarse lo antes posible, en cuanto cumplan los requisitos para recibirla, ya que esto ayudará a reducir la gravedad de la enfermedad y a desarrollar lo que se denomina inmunidad de manada, es decir, la inmunidad colectiva de la comunidad que ayuda a protegerse a sí misma y a los grupos vulnerables de la población. Aún se desconoce si la infección natural proporciona inmunidad, por lo que las personas deben vacunarse incluso si ya han padecido el virus, siempre que lo hagan una vez transcurrido el periodo de aislamiento de 10 días. Se ofrecerán más actualizaciones sobre el progreso de la vacunación una vez que comience la campaña en México.
Breaking news, the first ever mRNA vaccine for bird flu was approved by FDA, which shows about a 95% effectiveness in reducing the severity and transmission rate of bird flu. The rollout will occur in phases, which begins in the elderly, who will receive the vaccine starting next month, with people aged 50 and older receiving it in January of 2028. Then, as the rollout continues, people aged 18 and older will then receive the vaccine beginning in February of 2028. Children 12 and older will begin receiving the vaccine in March, with younger children receiving it in April. This is done in phases to allow the FDA to study the vaccine in each age group before approving it, much like how the COVID-19 vaccine rollout began. The CDC states that all residents should get vaccinated as soon as possible when they become eligible to receive it, as it will help reduce the severity of the disease and help build what's called herd immunity, where the community has collective immunity that helps protect themselves in vulnerable parts of the population. It is still unknown if natural infection provides immunity, which is why the CDC urges people to get vaccinated even if they have been sick with the virus, with the timing occurring after the isolation period of 10 days. More updates on the vaccination progress will be made once the rollout begins in the United States.
We interrupt this broadcast to give you emergency information from the UK Parliament. Listen very carefully to the instructions this broadcast will now give you. All channels will play this emergency message. All phone and tablet devices will be sent additional information following this message. Please pay attention to this alert as it indicates a significant threat to our nation. A national emergency has been declared in the United Kingdom by the Cabinet Office. At around 7 p.m. Greenwich Mean Time, scientists have made a horrifying discovery about H5N1, known as the bird flu. The virus had undergone reassortment with other strains, including the dangerous H5N1 subtype, which brings the mortality rate as high as 98%. This means that the virus will wipe out 90% to near 100% of the population in the UK, which makes government collapse likely. This effectively makes this a doomsday event. At this time, gather with your loved ones as we await our final moments together. We will conclude this final broadcast with the playing of the national anthem. May God have mercy on your souls.
A national emergency has been declared in Canada by the Canadian government. At around 3 p.m. Mountain Standard Time, scientists have made a horrifying discovery about H5N1 known as the bird flu. The virus had undergone reassortment with other strains including the dangerous H3N2 subtype, which brings the mortality rate as high as 98%. This means that the virus will wipe out 90% to near 100% of the population in Canada, which makes government collapse likely. This effectively makes this a doomsday event. At this time, gather with your loved ones as we await our final moments together. We will conclude this final broadcast with the playing of the national anthem. May God have mercy on your souls.
Le gouvernement canadien a déclaré l'état d'urgence national au Canada, aux alentours de 15 heures, heure normale des Rocheuses. Des scientifiques ont fait une découverte effroyable concernant le virus H5N1, connu sous le nom de grippe aviaire. Celui-ci a subi un réassortiment avec d'autres souches, notamment le dangereux sous-type H3N2, ce qui porte le taux de mortalité jusqu'à 98%. Cela signifie que le virus décimera entre 90% et près de 100% de la population canadienne, rendant probable l'effondrement du gouvernement. Il s'agit, en somme, d'une catastrophe apocalyptique. En cet instant, rejoignez vos proches alors que nous attendons de vivre nos derniers moments ensemble. Nous conclurons cette ultime émission par l'hymne national. Que Dieu ait pitié de vos âmes. El siguiente mensage se transmite à petición del Gobierno Federal de México. El Gobierno Federal de México ha declarado una emergencia nacional. Aproximadamente a las 4 p.m., hora estándar del centro, científicos realizaron un descubrimiento aterrador sobre el H5N1, conocido como gripe aviar. El virus ha experimentado una recombinación genética con otras cepas, incluida la peligrosa variante H3N2, lo que eleva la tasa de mortalidad hasta un 98%. Esto significa que el virus acabará con entre el 90% y casi el 100% de la población de México, lo que es probable el colapso del gobierno. En la práctica, esto convierte la situación en un evento apocalíptico. Legado este momento, renuncio con sus seres queridos mientras aguardamos junto nuestro último instante. Concluiremos esta última transmisión con la reproducción del himno nacional. Que Dios se apiade de sus almas.
The following message is transmitted at the request of the federal government of Mexico. The federal government of Mexico has declared a national emergency. At approximately 4 p.m. Central Standard Time, scientists made a terrifying discovery regarding H5N1, known as bird flu. The virus has undergone genetic recombination with other strains, including the dangerous H3N2 variant, raising the mortality rate to as high as 98%. This means the virus will wipe out between 90% and nearly 100% of Mexico's population, making a government collapse likely. Effectively, this turns the situation into an apocalyptic event. At this time, gather with your loved ones as we await our final moments together. We will conclude this final broadcast by playing the national anthem. May God have mercy on your souls.
Mexicano salido de guerra, el acero a prestar y el bidón, y retiembla en sus centros la tierra, al sonor rugir del cañón. Y retiembla en sus centros la tierra, al sonor rugir del cañón. Siño patria, tu sienes la oliva, de la paz el arcángel divino, en el cielo tu eterno destino, por el dedo de Dios se escribió. Mas si osare un extraño enemigo profanar con sus plantas tu suelo, pienso patria querida que el cielo un soldado cada hijo te dio, un soldado cada hijo te dio. Mexicano saltito de guerra, el acero aprestad y el bridón, y retiembla en sus centros la tierra, al sonoro rugir del cañón. Y retiembla en sus centros la tierra, al sonoro rugir del cañón.
We interrupt our programming. This is a national emergency. Important instructions will follow. The following message is transmitted at the request of the United States government and the Centers of Disease Control and Prevention. A national emergency has been declared in the United States by the United States government. At around 5 p.m. Eastern Standard Time, scientists have made a horrifying discovery about H5N1 known as the bird flu. The virus had undergone reassortment with other strains including the dangerous H5N1 subtype which brings the mortality rate as high as 98%. This means that the virus will wipe out 90% to near 100% of the population in the United States, which makes government collapse likely. This effectively makes this a doomsday event. At this time, gather with your loved ones as we await our final moments together. The President has selected a verse from the Bible to be read over the emergency alert system. Romans 6:23. For the wages of sin is death. The free gift of God is eternal life in our Lord Jesus. This station will conclude its final broadcast with the playing of the national anthem, And Nearer My God to Thee. May God have mercy on your souls.